Does your hip hurt so badly that you're convinced it's broken, even though your x-rays show a perfectly intact joint? You are not alone. Today, we're solving the mystery of the phantom fracture, why your hip can feel like a medical emergency when the bone is fine. This kind of pain can steal your independence, making every step feel like walking on a cracked foundation. But for many, the source isn't the bone, but the housing around it. Think of your hip as a door hinge. Most people focus on the metal hinge, the joint. But if the wood around it, the housing, is rotting, the door still won't swing. Your hip is the most complex weight-bearing structure in your body. It's surrounded by a thick housing of muscles, bursa sacs, and ligaments. One common reason for sharp pain is FAI, or femoroacetabular impingement. This happens when the bones of your hip are abnormally shaped and rub against each other. This mechanical friction can fray the labrum over time. It feels like a sudden catch or a sharp pinch when you try to sit in a deep chair or bring your knee to your chest. That leads us to the labrum, the ring of cartilage that deepens your hip socket. A tear here can feel like a catching or clicking sensation that radiates deep into the groin. Because this tear happens deep inside the joint, it often doesn't show up on standard x-rays, leaving patients frustrated and without answers for months. Next, let's talk about the outside of the hip. The most common culprit for broken feeling pain is greater trochanteric bursitis. These are fluid-filled sacs that act as shock absorbers. When these sacs become inflamed, even the pressure of a bedsheet can feel unbearable. It mimics the sharp, stabbing pain of a fracture, especially at night when you lie on that side. Often, bursitis is linked to IT band syndrome. The thick band of tissue running down your outer leg can snap over the bursa, causing a painful cycle of irritation and inflammation. Tightness in this band pulls on the housing we discussed, creating pressure that makes the joint feel like it's failing, even though the femur and pelvis are structurally sound. But what if the pain isn't in your hip at all? Many hip problems are actually back problems. Pinched nerves in your lower spine can send pain signals straight to your hip. This is referred pain. Your brain interprets the signal as coming from the hip, but the electrical short is happening in your lumbar vertebrae. It's a classic anatomical misdirection. We also have to distinguish this from osteoarthritis. While arthritis is a joint problem, the pain often comes from the muscles trying to protect the joint, not the bone-on-bone contact itself. Even with mild arthritis, your pain might be extra because of the secondary bursitis or tendinitis. Treating the soft tissue can often relieve 80% of the symptoms. Let's do a self-test for bursitis. Lie on your good side and press firmly on the bony part of your outer hip on the painful side. If that pressure triggers sharp pain, it's a soft tissue issue. This point tenderness is a hallmark sign. Joint pain usually feels deep and dull, while bursitis is superficial and sharp. Identifying this is the first step to the right treatment. The log roll test is for the joint itself. Lie flat and have someone, or yourself, roll your whole leg inward and outward. If this causes deep groin pain, it's more likely a labral or joint issue. Groin pain with rotation points to the hinge. Outer hip pain with pressure points to the housing. Knowing which one you have determines your exercise routine. The Fadear test checks for impingement, flexion, adduction, and internal rotation, bringing your knee up and across toward the opposite shoulder. Sharp groin pain here is a major sign of FAI. If you have a positive Fadear test, you must avoid deep squats and pigeon stretches for a while. You're essentially pinching that sensitive labrum every time you do them. Hack number 1, the sleeping bridge. If you're a side sleeper, your top leg can pull on the hip joint all night. Placing a thick pillow between your knees keeps the joint neutral. This simple alignment reduces the stretch on the bursa and the IT band, often providing the first full night of sleep you've had in weeks. It's a small change with a massive impact. Hack number 2, wake up your glutes. Your hip joint is often overworking because your butt muscles have gone to sleep. Weak glutes force the hip to take all the mechanical stress. Gentle glute bridges are the antidote. By strengthening the posterior chain, you provide the housing your hip hinge needs to function without pain. Aim for 2 sets of 10 every morning. Let's add clamshells. Lie on your side, knees bent, and lift your top knee while keeping your feet together. This targets the gluteus medius, the primary stabilizer of your hip. Stability is your best friend when mobility is painful. A strong glute medius prevents your pelvis from dropping when you walk, which is the #1 cause of IT band irritation and bursitis. The bird dog exercise connects your core to your hips. On all fours, extend the opposite arm and leg. This X pattern of stability protects both your lower back and your hip joints. Keep your back flat like a table. This prevents the spinal referred pain we discussed earlier. It's a 2-for-1 exercise for your back and your hip housing. If your pain feels like it's deep in the buttock, try the seated piriformis stretch. Cross your ankle over your knee and lean forward. This releases the deep rotator muscles that can pinch the sciatic nerve. Hold for 30 seconds. You should feel a deep, productive stretch, never sharp pain. If it's sharp, back off. We are looking for release, not additional irritation. What you eat matters. Inflammation is a systemic issue. Omega-3 fatty acids from fish and antioxidants from berries help lower the global heat in your bursa sacs and tendons. Think of nutrition as the chemical part of your housing maintenance. Hydration is also key. Dehydrated tissues are brittle and more prone to the fraying and tears we discussed. Every extra pound you carry adds 4 pounds of pressure to your hip joint with every step. Weight management isn't about vanity. It's about mechanical longevity for your hinge. Even a 5-pound weight loss can significantly reduce the broken feeling in your hip. It's like taking a heavy backpack off your skeleton every single day. Your feet are the foundation of your hips. If your shoes are worn out or lack support, your ankles collapse, forcing your hips to rotate inward and irritate the labrum and bursa. Invest in good footwear. If you wouldn't build a house on sand, don't build your hip health on flip-flops or flat loafers. Arch support is non-negotiable for hip recovery. If lifestyle and exercises aren't enough, we look at professional interventions. Cortisone injections can reset a chronically inflamed bursa, providing a window of relief so you can start your PT. There are also regenerative options like PRP or stem cell therapy that aim to heal the housing rather than just masking the pain. Discuss these with a specialist to see if you're a candidate. Sometimes the broken feeling is real, like a severe labral tear or end-stage arthritis. In these cases, arthroscopy or a hip replacement might be the best path to reclaim your life. Modern hip replacements are one of the most successful surgeries in medicine. Don't fear the procedure, fear the loss of your mobility. Reclaiming your walk is worth the effort. Let's talk about the magic of water. Hydrotherapy is an incredible tool for hip recovery. In the pool, the water supports 90% of your body weight, allowing you to move without joint strain. The resistance of the water provides a gentle way to build that housing strength without pinching the labrum. If land-based exercise is too painful, get in the water as soon as possible. It's life-changing. Let's stretch that IT band. Stand next to a wall for support. Cross your painful leg behind the other and lean your hips toward the wall. You'll feel a gentle pull along the entire outer thigh. Hold this for 30 seconds. This release reduces the tension on the housing and prevents the IT band from snapping over the inflamed bursa sacs we talked about. Repeat on both sides. To build strength without joint strain, try wall squats. Keep your back flat against the wall and slowly lower yourself just a few inches. This builds the quads that support your hip hinge. Quality over quantity is key. Focus on keeping your knees tracking over your toes. Strong thighs act as secondary shock absorbers, taking the load off your intact but painful joint. Balance is the final piece of the puzzle. Try standing on one leg while you wait for your coffee to brew. Use a counter for safety. This trains the tiny stabilizer muscles in your hip housing. Hold for 10 seconds, then switch. As your balance improves, your hip joint becomes more resilient to the micro shocks of daily life that cause that broken feeling. Stability equals longevity. Let's look at your spice cabinet. Turmeric and ginger are powerful natural anti-inflammatories. Adding them to your meals can help lower the heat in your hip tissues from the inside out. These natural compounds work cumulatively. Consistent inclusion in your diet supports the soft tissue healing process we've been working on with our exercises. Think of it as biology-based recovery. Fiber isn't just for digestion, it's for weight management. Foods like oats and beans keep you full longer, helping you maintain that healthy weight that protects your hip hinge from gravity. Every pound you don't carry is a pound your hip joint doesn't have to absorb. Managing your weight through high-fiber nutrition is one of the kindest things you can do for your skeletal health. Your body heals when you sleep. If your hip pain is keeping you up, ensure your room is cool and dark. A better sleep environment supports the hormonal repair of those inflamed bursa sacs. Pair your knee pillow with a consistent bedtime. Deep restorative sleep is where the magic of soft tissue recovery happens. Don't underestimate the power of a good night's rest on your pain levels. Lastly, let's address the mind-body connection. Chronic pain can wire your brain to stay on high alert. Practicing just 5 minutes of mindfulness can help lower your nervous system's sensitivity to those hip signals. When you relax your mind, you relax your housing. By lowering your overall stress, you reduce the muscular guarding that makes your hip feel like it's broken. You are retraining your brain for peace. Take Martha, a grandmother of 4. She was using a walker because of phantom fracture pain. After combining these exercises, nutrition, and better sleep, she's back to chasing her grandkids in the park. No surgery needed. Martha reclaimed her freedom by listening to her body's soft tissue needs. That same path is open to you. One step, one stretch, one better meal at a time. You can do this. I see your final questions. Heat or ice? Generally, ice for acute sharp inflammation like bursitis, and heat for chronic dull muscle stiffness. Listen to what feels best for your unique housing. You are the expert on your own body. Use this roadmap to reclaim your walk and your life. I'm Dr. Deepins, and it's been an honor to guide you. Stay strong and stay mobile. If this journey helped you, please subscribe and share it with someone who needs hope. Let's build a healthier community together. See you in the next deep dive. Take care.